Hey everybody, we're going to start the muscular system. You guys should have labeled a muscle man already. I'm doing this kind of old school. I know the slides sometimes are a little hard to see. I'm hoping it works out okay. I know that we've had a lot of audio issues with trying to use um, the Chromebook recording. So hopefully we can get this where you can hear it and then the slides will be there and available to you. So let's get started. Okay, so the muscles make up about half of your body weight. That's a lot because when we talked about the bones make up about 25% of your body weight. So that's a big portion. Your musculoskeletal system make up most of your body weight. The human body has about 656 different muscles. I'm not going to ask you to learn 656 different muscles, as you could tell from the muscle anterior posterior muscle man that you filled out. I will narrow it down a little more for you before your test, so don't worry. So what muscles do is they give us shape and form, and if you think about it, they're how our skeleton actually stands up and moves. So it's responsible for movement. They're responsible for warmth. Our muscular system is responsible for our shape. So think about that. Think about all the things muscles do, and when one acts, another muscle has to react to it. There are 3 types of muscle, and you will need to know the 3 types of muscle. Okay. The 3 types of muscle are skeletal muscle, and skeletal muscle is attached to your skeletal system. So it's attached to the bones. And it is striated, which means looks like it's kind of has lines in it. And it's very tough. Then we have smooth muscle. Smooth muscle is what's on the inside of our organs, and it's also what's on the inside of your mouth. It's what's down your esophagus. It's what's in your intestines. Smooth muscle. Smooth muscle is just kind of like what it says. It's smooth. It's plate-like. It's kind of flat, and it's a little more fragile than skeletal muscle. And then we have cardiac muscle. Now, cardiac muscle is pretty self-explanatory because the only place it's found is in the heart. Cardiac muscle is striated like skeletal muscle because it needs to be very strong. And if you think about cardiac muscle, the heart muscle, once it starts beating, it doesn't stop. Kind of when we talked about the cardiac unit earlier, the cardiac muscle is very strong, and it is connected with something called intercalated discs, which you guys don't have to remember right now. You will later, but you don't now. It kind of has little branches, and it has multiple nucleus. So does skeletal muscle. Skeletal muscle has multiple nucleuses because it takes a lot of energy and a lot of repair for them to be able to work. Smooth muscle has 1 nucleus. So skeletal muscle, like I said, is attached to bones. These are things you need to remember. Skeletal muscle attaches to bones or attaches to the skeletal system. It's striped or striated. Striated just means it has lines in it. It is voluntary. So skeletal muscle, you have to think about it before it happens. So it has to do with movement. You have to think it before it happens. Each muscle is multinucleated, which means it has many muscles, and it also has muscle fibers. And we'll talk about muscle fibers and how skeletal muscle is bundled together with something called myofibrils. The cell membrane of the muscle cell is called the sarcolemma. So you'll want to remember that. The cell membrane of the muscle cell is called the sarcolemma. That's the membrane around the outer of the cell. The cytoplasm of the cell is sarcoplasm. So cytoplasm is kind of the jelly stuff that kind of holds all the organelles together inside the cell. Cytoplasm in a normal cell is called cytoplasm, but in a muscle cell, a skeletal muscle cell, it's called sarcoplasm. Now let's talk about smooth muscle. So be sure you guys remember, let me go back, be sure you guys remember that skeletal muscle is attached to bones, that it is striated, that it is voluntary, it has multiple nucleus, that the outer membrane is called the sarcolemma, and that the cytoplasm is in the muscle cell is called sarcoplasm. Let's talk about smooth muscle, or visceral muscle. And we call it visceral because it's generally near, in, around, or part of an organ. It's small and spindle-shaped. So smooth muscle cells are very small. They have one nucleus. They have no lines or no striations. So they're single nucleated, and they have spindle-shaped fibers. They do not attach to bones. They are much slower, but they have a lot of endurance. So skeletal muscle can react quickly due to the nervous system, but smooth muscles react slower, and they can, because they move slower or they react slower, they can work longer without becoming tired. So they have more endurance. So smooth muscle cells have more endurance. They remain contracted for a long time. So they can remain contracted for a long time. Where your skeletal muscles would become tired and sore, smooth muscle doesn't. Smooth muscle is involuntary, and it's controlled by the autonomic nervous system. So things to remember about smooth muscle. They are small cells that are spindle-shaped. They have one nucleus. They act slowly, so they respond slowly, but have high endurance. They can remain contracted for a long period of time. They are involuntary, which means that we don't have to think about it, they just do. And they're controlled by the autonomic nervous system. So remember, autonomic nervous system, involuntary. They tire slowly, and they act slowly. They can remain contracted for long periods, and they have one nucleus. Smooth muscle also are found in the walls of the stomach, the intestine, the uterus, and blood vessels. So that's why they can contract. Think about if someone is having a baby, the uterus has to contract continually to deliver that baby, so it can't tire quickly. Your intestines are always moving food and nutrients around from the stomach down into the small intestines, large intestines. It takes a lot of work for absorption and all that kind of thing to happen for you to get all of the nutrients you need. So they can't tire. Your stomach has to contract and help process food. So they have to don't have to work fast, but they have to work for long periods. So remember that they're found in the, because a question I may ask would be, which of the following is not a location that you would find smooth muscle? And I might say stomach, uterus, blood vessels, and the thigh. Well, you wouldn't find it in the thigh. So what they do is they help, like it said, uterine contractions. It can help control the diameter, how quickly blood flows through the body. They also control how food passes through the body. Okay, so let's talk about cardiac muscle. Cardiac muscle is only found in the heart. It is only found in the heart. One of the things that makes it similar to skeletal muscle is it's striated. That means it's very strong. It's similar to smooth muscle because it's involuntary. Because think about it. If you had to think of every time your heart beat, some of us, and me included here, might not live very long. So cardiac muscle is involuntary. It's controlled by the autonomic nervous system. They're joined in a continuous network. So they have those intercalated discs that join them together. to make them beat together, so the heart can beat correctly. So when one cell receives a signal to contract, they all contract together. So not all of the heart receives nerve impulses. Only certain parts receive nerve muscle, but it makes all of the cells in that area contract at the same time. So if you remember when we talked about the heart, you have the atrium contract at one time and the ventricles contract at the same time. So when the signal from the heart, from the sinoatrial node fires, the atriums contract. And when the impulse from the atrioventricular node fires, the ventricles contract. But those impulses don't get to every cell. So when one cell receives the signal, they all contract together. The normal heart rate is anywhere from, it says 72 beats a minute. I'm going to tell you anywhere from 60 to 100 is a normal heart rate. Cardiac cells have to have continuous oxygen to function. Cells start to die within 30 seconds. So when someone has a heart attack, and remember we talked about those coronary arteries on the outside of the heart, when blood is not flowing continuously to and from that, the heart muscle starts to die. When the heart muscle dies, it doesn't repair. And so our heart has to function without its full capacity. So remember, the heart has to have continuous oxygen to function. So cardiac muscle is only in the heart. It is striated for strength. It's involuntary. The cells are joined by a continuous network. When one of the cells in an area receives an impulse from the nervous system to contract, they all contract. Same thing for it to relax. When they need to relax, when they get that signal to relax, they all relax. Normal heart rate is 60 to 100, and heart cells begin to die within 30 seconds of oxygen depletion. I want you to remember that. Within 30 seconds of loss of oxygen, heart cells start to die, which is why it's so important when someone goes into cardiac arrest to get CPR started and get an AED as soon as possible. Sphincters and dilator muscles. So sphincters and dilator muscles, we find those in the intestines, in the stomach, in the esophagus, in the mouth, in the urethra, in the anus, and those are basically doorways that open and close to let things flow through. So sphincters and dilators open and close to allow things to pass through. Our mouth is a voluntary sphincter, but we have a pyloric and a cardiac and a gastric sphincter in our stomach, and that allows food to come in through the esophagus and be processed, and when that happens, the cardiac sphincter opens as food comes down the esophagus to let food in the stomach, and the gastric sphincter closes off. And then when the food's processed and ready to go down into the small intestines, that gastric sphincter opens, but the cardiac sphincter closes at the top of the stomach, so nothing flows back up. It's similar to in the heart when we talked about valves. They help substances they help them pass through one way and not to backflow. But sphincters open and close based on what's going on. They are a circular shaped muscle. And so just remember that sphincter and dilator muscles open and close to allow things to pass through. Okay, so principal skeletal muscles, remember that they're voluntary. They are attached but with ligaments and tendons. They attach with ligaments and tendons to the skeleton. Ligaments attach. Let me back up. Okay, so they're voluntary and they allow mobility. So remember that skeletal muscles are voluntary and they allow mobility. They make up the lining of the oral abdominal and the pelvic walls. So we have muscles outside our mouth. We have muscles that are in front of our abdominal wall, and we have muscles in our pelvic cavity. We have those because they also help protect us. We control the movement of our eyeballs, control movement of eyeballs, eyelids, lips, tongue, skin. So the skeletal muscles control that movement. And there are lots of times they're named based on where their origin. Like say your quadricep is called a quadricep because there are 4 muscles at the open or where they attach. There's 4 muscles there. Sometimes it's because of their direction. Sometimes it's based on what they do. The rectus femoris is a muscle in the thigh that you must have to stand up. The rectus abdominis is the same thing. You must have that muscle intact to sit up. So sometimes they're based on their location or their action. So there's multiple ways, as you could saw, or sometimes they're based on the shape of the muscle. When you were doing your muscle man, you saw the orbicularis oris and the orbicularis oculi. Well, the orbicularis means that it is circular, and that muscle around the eye, actually, and around the mouth, it looks circular. So that would be named based on its shape. Some examples are the location of fontanelles. They're in the forehead. Fontanalis is in the forehead. Gluteus maximus is the largest muscle. That's the one based on size, and that's in your behind. Number of origins. So the bicep, it has 2 heads that attach to the humerus. Biceps in your arm, it has 2 heads that attach to the humerus. Location of insertion and origin, sternocleidomastoid. And I always put this on the test, so know where the sternocleidomastoid is. That means it originates at the sternum, so that's why it's called the sternocleidomastoid. It also connects to the mastoid bone and goes through the neck there. It's an angular muscle that runs from the mastoid bone all the way down to the sternum, top of the sternum. So other information, if you have 656 muscles in the human body, then we have to have 327 antagonistic pairs. That means you got to have one muscle that does one thing, and then you have another muscle that counteracts it. So when I contract my bicep, my tricep relaxes, and when I relax my bicep, my tricep relaxes. So those are antagonistic muscle pairs. There are only 2 unpaired muscles. I would remember these. There are only 2 unpaired muscles. That would be the orbicularis oris. Oris means what? That would be the muscle around the mouth. It does not have a antagonistic pair. And your diaphragm, which is under the lungs. Muscles are broken down into regions. You have the head, and then head, neck, trunk, and extremity muscles. Now, there are 4 things that all muscles have in common, and I would remember this because I can see this being on a question on the test. Which of the following is not one of the 4 things all muscles have in common? So they all have contractibility. That means they all shorten. Contractibility means all muscles can shorten and decrease in distance by width or length, depending on where it is. No other cells in the body can contract other than muscle cells. They have excitability. That means that they respond to nerve impulses. The electrical response or the chemical response from the nervous system. So they have contractibility, they have excitability, they have extensibility, which means they can stretch. So they can contract, they have excitability, they have extensibility, and they have elasticity. That means if they get stretched, they can shrink back. And so if you think about contractibility and you think about it like that: contractibility, excitability, extensibility, and elasticity. Those are the 4 things all muscles have in common. Muscle attachments and functions. Muscles have to be attached to a bone. Skeletal muscle that has to be attached to a bone so that it can move. Muscles can only push. They can never pull. That's why you have those 2 pairs of antagonistic. You have pairs of antagonistic muscles. If they can only pull, so when When I pull my arm up and I'm straightening it out, I'm not really pushing. I'm actually pulling a different muscle, making another muscle move. Muscle attachments and functions. So let's talk about those. Origin is the part of the muscle that attaches to a fixed structure. So the origin is the part that attaches to the bone. Origin is the part of the muscle that attaches to the bone. And it moves the least when you contract a muscle. The insertion is at the end of an attachment. So a while ago we talked about the bicep, and it has two heads that insert into the humerus, near the head of the humerus. The insertion is going to be at the bottom of the humerus near the elbow. So that insertion is actually the part that moves the most during contraction. So insertion is at the other end of the attachment. So it's the other end of the muscle. Your central body muscle in the abdomen is very important for all movement. The weaker your muscles in the abdomen, your core muscles, your abdomen and trunk are, the less mobile you are. And then your muscles work in pairs. Your prime muscles work in pairs to produce a movement in a single direction. So like that bicep and tricep, one moves one direction, the other moves one contracts to bend and one contracts to straighten. So those are your prime movers. Your leg muscles, your arm muscles, those are your prime movers. We talked about an antagonistic already, and that's that muscle that acts the opposite. So it is pulling when another one, it's contracting when another one is releasing. Synergistic would be a group of muscles that work together for stability. So like your biceps and your quadriceps and your abdominal muscles, those muscle groups work together to improve stability and movement. We have the quadriceps that helps with stability when we stand, but also with the joint stability of the hip and the knee. So an example of an antagonistic pair would be the bicep and the tricep, and we talked about that already. So remember that, I talked about this earlier, how muscles are a source of energy and heat. The more muscle mass you have, the warmer you are. If we have a higher fat content, percent of body fat, we actually tend to be a little colder in nature. Our body temperature should be between 98.6 and 99.8. It just kind of depend on muscle mass. It depends on a number of things. I want you to remember that muscles make ATP. Muscles make ATP, adenosine triphosphate. So you should have learned some of that in biology already this year. Muscle cells make adenosine triphosphate, or ATP. ATP is necessary for muscles to contract. The body must have ATP to function. It makes, so remember that ATP is necessary for muscles to contract, and it makes heat for the body. Muscles make ATP, adenosine triphosphate, and it is necessary for muscle contraction. Okay, so let's talk about the contraction of skeletal muscle. There are two things that cause that. And I want the myoneural stimulation. What I want you to remember there is it's a nerve impulse. It's when you think about moving, and your brain sends a signal to your legs to tell you to stand up. So the brain, that's the first part. The brain sends a signal to your legs to say stand up. That's the myoneural stimulation. You thought about it. And then contraction of the muscle proteins. That is when you actually stand up and these little fibers in the muscle move back and forth across each other and cause that nerve impulse for movement to happen. So there are five steps to every muscle movement. And it says to look in the book for this, but I'm just going to tell you about it. So what happens is we have that nerve impulse. And a nerve impulse is basically an electric impulse that goes from the dendrites, or the top of the nerve cell, through the cell body, down the axon, which is a long kind of tail-looking thing off of the nerve cell, and it makes acetylcholine. Acetylcholine is a neurotransmitter. Now, I'm not going to ask you to remember these 5 steps just yet. It is something we learn later. If you take anatomy, you will definitely learn it, and you will also learn it if you take more advanced health science courses. So acetylcholine is a neurotransmitter, these chemicals that are at the end, that then dump into the end of the nerve cells, called a synaptic cleft, and then they go on to that sarcolemma. And remember, sarcolemma is the muscle, skeletal muscle membrane, and they activate a response. So what is happening is you're thinking about something, and it's sending a signal from your brain down to, if you're thinking about standing up, down to your quadriceps and to your abdomen, and maybe to your hands, because you're going to push up with your hands. And so it sends that impulse down to the very last nerves, and it dumps those neurotransmitters, which are chemicals that cause that impulse to move on to the muscle fiber to make that movement happen. And then cells must return to their resting state once that nerve impulse stops. And there are things called sodium and potassium pumps that, sodium, potassium, and calcium channel pumps that make that actually happen. And that's, once again, that's one of those higher level things. But I want you to remember that there are 5 steps in muscle movement. I'm not going to ask you to name them all, but remember there are 5 steps in muscle movement. And the 2 things that cause muscle movement are the myoneural stimulation, that's thinking about it, and then the contraction of the muscle proteins that actually cause the movement. Muscle tone and fatigue. So muscle tone is, muscles are always slightly contracted, and they give us kind of our posture and our shape. And so we want to make sure that we eat right and that we get regular exercise so that muscles maintain a good form. If we don't use muscles, they shrink. If any of you have ever had a broken arm or leg, or been in a cast or a splint for a long period, and you take that off, then when you look and you compare it to your other arm or leg, usually that other arm or leg is much smaller because you haven't been able to use those muscles, and they shrink. So atrophy means shrinkage of a muscle due to lack of use. So it changes the muscle tone. Muscle tone is what we should always have, a good muscle tone to keep our shape, and we maintain that by regular exercise and good nutrition. If we don't eat right, or we don't exercise, or we don't use our muscles, they shrink, and that's called atrophy. People who over-exercise, or who have really, really large, enlarged muscles, that's called hypertrophy. If any of you guys know anybody who pitches, this is an example, anybody who pitches baseball or softball, if you look at their pitching arm, the bicep on their pitching arm and the tricep is probably going to be bigger on their pitching arm than on their non-pitching arm. So look at that, because that's where you're going to see hypertrophy, where it's an uneven, sometimes muscle size due to use. Now, muscle fatigue is what happens when we overutilize a muscle and lactic acid builds up. If any of you ever had to work out or started exercising or lifting stuff you don't normally do, and you get up the next morning and you're just so sore you feel like you can't move. Well, that's because you fatigued your muscles and lactic acid built up in those muscles. And the only way to get that out is some stretching and movement and drinking lots of fluids. So you can correlate lactic acid buildup to muscle fatigue, okay? Exercise and training. So exercise and training changes the size and structure and strength of all of our muscles. We talked about if we don't use them, they go away and they atrophy, and if we overuse them, they hypertrophy. The purpose of exercise and training is to improve coordination, to improve respiratory and circulatory system, to improve our cardiovascular state, to make our heart stronger, to make our vessels stronger, to give us a better lung capacity. It helps us lose weight, and it also helps with joint movement, and it can de-stress joints. Strength can improve muscle size, coordination, and function of the brain. So being mobile and getting oxygen and better circulation and having better mobility actually improves your brain function. So, and any of you who have learned to play a new sport or learned to do something new, even if it's as simple as playing some kind of game with your hand, you improve your coordination when you do that. So, muscle strength improves muscle size, muscle coordination, and function. Now let's talk about what happens when we injure, some of the things that are called, that we would relate to injury and overuse. And if any of you have been active young people, then you've probably had one or all of these things happen to you. A sprain is when the ligaments are either torn from the attachment to they're torn at the bone, or they're torn across. You have excessive swelling and very severe pain immediately. So a sprain is a tearing of the ligaments. And it may not be a full tear, it may be just a small tear, but a sprain, and there are different degrees of a sprain. But you'll see swelling and pain and bruising pretty quickly. Pretty much all we do with that is give it some anti-inflammatories and elevate it due to the swelling and have you rest it. There's not a lot else we can do. The body will repair it. A strain is a tear of the muscle. A strain is a tear of the muscle. So when you lift weights, you're straining your muscles. So remember that a sprain is a tear of the ligaments and a strain is a tear of the muscle. We treat strains, muscle tears, with ice and anti-inflammatory sometimes if necessary. Bursitis, on the other hand, remember when we learned about bones, we talked about the bursa sac, and that's that synovial sac that helps the joints move smoothly. Well, sometimes the fluid in there, we either lose it or it gets that sac gets injured, so that it can have inflammation there, or it can actually lose fluid. And when that happens, then the bones tend to rub up against each other, and they have friction, and it causes injury. So it causes more inflammation in that area. So bursitis is when you have an inflammation or a leakage of the fluid in that synovial sac or in that bursa sac, and so there's not that lubrication to prevent friction, and it causes increased friction. Muscle spasm, those are muscle cramps. It is a sustained contraction of the muscle longer than expected. It can be due to just an overexcitability of a nerve, or it could be due to an electrolyte imbalance, dehydration, things like that. So a muscle spasm is a cramp or a sustained contraction of the muscle. Myalgia, these are just vocabulary you guys will need to know, means muscle pain. Muscular dystrophy is a group of diseases that cause cells to deteriorate. So the cells start to die over time, and they don't regenerate. They don't regrow. Myasthenia gravis is a progressive muscular weakness that leads to paralysis and sometimes leads to death. There's no true known cause, but it can be correlated to the Epstein-Barr virus sometimes. Tendons. So tendons are cords that connect tissues of connective tissue that attach muscles to bone. You need to remember that tendons are connective tissue that attach muscles to bone. Sometimes we excessively stretch those and can cause some damage to tendons. and they're unable to make contact. And what happens then is they're more susceptible to straining or tearing. If we overstretch or hyperextend tendons, then we tend to put them in a position until they heal of excessive straining or tearing. So remember that tendons are connective tissue that connect muscle to bone. Things that are recreational injuries that people have: tendinitis or lateral epicondylitis. That tennis elbow, it is an inflammation of the elbow tendon, the tendon of the elbow, and usually we just use ice packs, anti-inflammatories. If it doesn't heal, then sometimes they have to go in and clean out that elbow with surgery. So remember, tennis elbow is generally considered a recreational injury, but not always. It's repetitive use of the arm. I have seen people who play the Wii get tennis elbow. So that's kind of funny, but I have seen that. Shin splints. Shin splints occur when there's injury to the muscle tendon in the front of the shin. It usually occurs especially for someone who is new to running or jogging, or they change the environment that they jog in or run in. Maybe they're used to jogging on a indoor padded track and they decide to go run on the road, the paved road, then it can cause that. Also, if you don't wear good running shoes, that definitely can cause shin splints. So those are the two most common reasons: is change of terrain that you run on, or starting to run, and then wearing shoes that don't fit well. You don't want to wear Converse to run in. That's the worst thing you can do. It causes some severe foot pain and shin splints. Rotator cuff disease, that can be either just inflammation of the rotator cuff, which is in the shoulder, or you could actually have tearing. We think about that inflammation. We think about those things with people who pitch softball or baseball, who play tennis, who play golf. You can have rotator cuff issues. People who play football, that repetitive movement of that shoulder can cause inflammation, or it can cause tearing of the rotator cuff. If it's not torn completely, then lots of times rest and physical therapy can help. Once it gets torn, sometimes you have to do surgical repair. Lots of times, lots of skeletal muscle minor injuries can be helped with massage therapy. They can get a total body massage, or a localized massage that is just local to one area. We use physiotherapy for different types of injuries, and that would be heat, cold, ultrasound, exercise, massage, TENS unit, water baths, ice baths. If you've ever had a muscle injury, you may have done some of that physiotherapy where you went to physical therapy and they did multiple different types of treatment. Iced you, then maybe did the stem or TENS unit, and then you went and did some exercise, and they did some massage afterwards, and then they put you in a water bath or an ice bath. Sometimes it's just doing the exercise in a pool to decrease the impact. Intermuscular injections. So I just want to briefly go over this, just simply because a lot of you guys get shots, and I want you to know where, as a future healthcare provider, where the most common places shots are given. The deltoid muscle, which is in the upper arm, the vastus lateralis, which is the anterior thigh, and the gluteus medius, which is not on the outside of the behind, but kind of in the middle. I will probably ask you a question about which of the following is not a normal muscle for intermuscular injections. And I will not list upper arm, anterior thigh, and buttocks. I will list deltoid, vastus lateralis, and gluteus medius. You know, I may add vastus medialis, or I might add gluteus maximus on there, and you'll have to tell me which one doesn't belong. Now, you guys looked at and labeled your muscle labeled your muscle man. The next few slides I'm not going to go over, but I want you to pay specific attention to some of the ones I talk about. I'm not going to go over location and function. You guys can read that. You're very capable, but I do want to kind of throw out some muscles that you're probably going to see on your test, so know where they are because you're going to label your muscle man. It'll be multiple choice though. So once I told you, I always use sternocleidomastoid. Trapezius and deltoid are pretty common muscles that people have issues with. Your trapezius is on the upper back, the deltoid's on the shoulder. Biceps brachii, triceps brachii, the pectoralis major, those are ones I tend to put on tests. Intercostal muscles, I'm probably not going to put that, but rectus abdominis and the latissimus dorsi, because that's on the outside of the spine, around the spine, around the chest area. So I'm probably going to put those two on there, of those three. Gluteus maximus, the sartorius I probably won't. Quadriceps femoris, very likely. Tibialis anterior and the gastrocnemius, those are two I tend to put on there. And where it says hamstring, it's actually 3 muscles. So I tend to put biceps femoris on the test and semimembranous and semitendinous. I tend to put those on there. But biceps femoris I usually do put on there because it can be confused with the biceps brachii. All right, guys, that is it for muscles. You guys for the muscle lecture. You guys have a great day, and I will be back with you soon. Thank you so much.